Insights.
This is Akashvani. In the program Insights, now we bring you a discussion on Tobacco Free Youth Campaign 3.0. The participants are Dr. L. Swasticharan, DDG and Director, Emergency Medical Relief, Ministry of Health and Family Welfare, and Deeksha Saksena, Akashvani Correspondent.
Tobacco Free Youth Campaign 3.0 was launched today with an objective of reaffirming the government's commitment to create a tobacco-free learning environment. It also aims at protecting the health of young citizens across India. To discuss more on the aims and objectives of this campaign, we are now joined by Dr. L. Swasticharan, DDG and Director, Emergency Medical Relief from the Ministry of Health and Family Welfare. Dr. Swasticharan, welcome to Akashvani News.
Thank you very much.
First of all, before we dive deep into the discussion, I would like to understand from you, and tobacco consumption is a serious health concern and approximately 13 lakh lives are lost annually due to tobacco consumption. So what are the objectives of this 60-day campaign?
Tobacco has got serious adverse effects on the health and economy as well as environment of the particular country, including India. And the campaign that we have, the Tobacco Free Youth Campaign, is one of the Ministry of Health and Family Welfare's flagship initiatives. Rather, it's a movement which began in 2023 and has grown stronger every year. It's not just a campaign, it is in a way a national goal to protect our young people from the harms of tobacco and nicotine. The objective is very simple yet powerful: to educate, empower and inspire youth to stay away from tobacco and also to help those who wish to quit it. It strengthens the enforcement of our key laws that we have, the Cigarette and Other Tobacco Products Act, the COTPA 2003, and also Prohibition of Electronic Cigarettes Act, which is known as the PECA 2019, while also promoting tobacco-free educational institutions and tobacco-free villages. In a way, we are seeing tremendous participation. Last year alone, our campaign reached about 47.9 crore people on social media. 27,000 villages became tobacco-free. This Tobacco-Free Youth Campaign 3.0, we are trying to build the momentum. So it is, in a way, this heart, a campaign with an appeal from the heart to give every young Indian a fair chance to a healthier, brighter and tobacco-free life.
You spoke about the campaign in detail, and the government has adopted a whole-of-government approach to address this issue. Which are the other ministries which are involved in this campaign?
Sometimes we in the health ministry, we have the problem, but we don't have the solution within the health ministry. So the solution is elsewhere beyond the health ministry. So tobacco is also one of those risk factors for the non-communicable diseases. That's why a campaign like this needs to embody a whole of government approach, and the Ministry of Health is working closely with other ministries like the Ministries of Education, Information and Broadcasting, Electronics and IT, Panchayati Raj, Rural Development, Youth Affairs and Sports, Tribal Affairs, Finance, Home Affairs, Labor, Corporate Affairs, and very importantly, the Ministry of Social Justice and Empowerment, with whom we are dovetailing our work with the Nasha Mukt Bharat Abhiyan. So each ministry has a vital role, from keeping schools and colleges tobacco-free to regulating online sales and advertising, and also to empowering panchayats and youth clubs at the grassroots.
The Global Youth Tobacco Survey reported that 8.4% of students aged between 13 to 15 years currently use tobacco products, with an average initiation age of 10 years. So, first of all, is there any legal provision of any shopkeeper or any shop which is selling tobacco to underage citizens?
Yes, let me say that there is a legal punishment. Yes, indeed, under the Cigarette and Other Tobacco Products Act 2003, Section 6A and Section 6B, there is a prohibition of sale of tobacco to anyone below 18 years of age and also within 100 yards of educational institutions. Say we have a boundary of the school, so within 100 yards of that boundary of the school, there should not be any shop which could be selling any tobacco product. So selling tobacco to minors is a punishable offense. Violators can face fines and even imprisonment under the COTPA, and also another act which is known as the Juvenile Justice Act and other local laws. Though the Tobacco-Free Youth Campaign, through this campaign, we have strengthened enforcement of these provisions, and in the last 2 years, states have reported increased vigilance and also compliance. So this isn't just about law, it is about protecting our children's right to grow up healthy and addiction-free.
So you spoke about healthy and addiction free. I would now like to bring your attention to the another aspect of tobacco consumption. Apart from health hazards, could you highlight what are the other drawbacks of tobacco consumption?
Health hazards, the first thing is if you are healthy, you are productive. That's the first thing. So if you're not healthy, you are not productive. You are sick. You will be suffering from many of the tobacco-related diseases, particularly the non-communicable diseases. And then if you suffer from cancer, then the life of a cancer patient, unfortunately, is very, very grave. The doctors will call you every 3 months and then try to assess you after 3 months. And then the treatment is not inexpensive. It is very difficult. And the chance of survival is also usually very low for most of the cancers, especially related to those to tobacco. So you drag down the family. So you might have a PMJ package, you might have an insurance, but you will exhaust that particular insurance package of your whole family. And ultimately, if you die, the family also is dragged down economically below the poverty line, sometimes in some situations. And tobacco, that way, is a developmental issue. It's an issue which is challenging the Viksit Bharat dream of this country. And also it has effects on the environment, the tobacco growing areas, and also the excess amount of fertilizers and pesticides that you have to use, and also the curing process of the tobacco products involves cutting down the trees, leading into deforestation, etc. So it has got an effect on the environment, etc. That is also one of the. And then we have got children going to the interior of the forest to pluck the tendu leaves, which are used for rolling beedis, and then these are cottage industries. In some cases, the children might drop out from school for rolling the beedis, or also for going to pluck the tendu leaves during the season, etc. So there are many livelihood issues also associated. And green tobacco sickness, for example, if you go to the tobacco field with your skin exposed to the leaves of the growing tobacco plant, the nicotine can be absorbed and you can have high nicotine content in your body. And also if you are a beedi roller, you will inhale all the dust of the tobacco and you will suffer from what is known as brown tobacco sickness, etc. So in many ways, the tobacco has got a lot of effect in the life of the human being. So that is why, if you are looking at the Sustainable Development Goals, tobacco has got these nefarious effects on many areas of life.
Dr. Swasticharan, I would also like to ask you, as per the survey done by the government, what are the key reasons for youth to get involved in consumption of tobacco, and how are you targeting the pulse of the problem?
When we are young, we are obsessed with curiosity, we are obsessed with peer pressures, and also the illusion of being cool or looking cool, etc. So those things, we are at a very stage when we want to experiment many things in life. And also the tobacco industry, we said in the beginning that the industry's product, the tobacco products, kills about 13.5 lakh people every year. So that's a losing customer base also. So the many industries, including tobacco, they also try to get young people hooked into it. So because of this, they play with various tactics known as increasing attractiveness and increasing addictiveness, as well as also downplaying the toxicity, etc. So there are a lot of these tactics which they target the young people, and also a lot of surrogate advertisement, a lot of suggestions, even in films, that tobacco is associated with certain roles which the young people, identify themselves with, etc. So there are various factors during which the youth is vulnerable, and that is why they try to pick up tobacco. And unfortunately, tobacco could be a gateway product from where the youth can graduate to other harmful substances, etc. That's why this campaign targeting the youth, trying to stop them at the tobacco level is very, very important.
In fact, you mentioned that they use surrogate advertisements and attractive colors to attract the youth for tobacco consumption. So here I would also like to mention that the tobacco industry markets tobacco and nicotine products as less harmful, or we can say novel products like gadgets or toys and attractive packaging. And talking about the e-cigarettes, despite the ban on e-cigarettes, it is available in the black market. So what are the stringent measures that the government is trying to ban the sale of e-cigarettes?
Whenever there is a ban, there is always smuggling which will happen. It's the same case with the prohibition of electronic cigarettes, egg, etc. And to have an egg which clearly bans is the first thing. With this act in place, at least you do not have open sales and production sale or import and export of advertisement of e-cigarette. But the other aspect, the challenge of illegal products being sold, we are working very closely with Ministry of Home Affairs and the Ministry of Electronics and IT as well as the police and enforcement agencies to ensure strict compliance. And several seizures and crackdowns have been reported and informed to us in coordination to us by the Customs and the National Tobacco Control Program team. So we have also empowered the citizens through an online reporting portal through which we get a report for violations and upload evidences. We take action through the agencies identified. Our message is very clear that these so-called novel products are not safe. No tobacco product is safe, and there is no safe limit for any of the chemicals contained in tobacco. They are not trendy, and they should not have a place in a healthy India.
The campaign also seeks to educate and empower children and youth to prevent initiation of tobacco use and support those who wish to quit. So how will this aspect be taken care of, and is there any provision of counseling and support groups as well?
Yes, under the National Tobacco Control Program, we have a quit line. So whenever we try to prevent people from initiation by a lot of IEC material, you see it in movie halls, you see it in televisions, and you see it everywhere. And we wish that nobody initiates the tobacco use. But if someone has unfortunately initiated, we work with them, we request them to quit. And to make this quitting of tobacco easy and accessible, every tobacco product has got a pack warning, and there we have got the National Tobacco Quit Line number, which is 1800112356. So this number, I'll repeat again, 1800112356. So if you call this, there is free counseling services in 16 Indian languages. So we are just a call away. That's the one thing. Then if you think that you are not able to quit by the tele-counseling, which you get through the quit line, we have about 2,000 tobacco cessation centers in all our district hospitals, in all the dental colleges and also the medical colleges. And today's campaign, we have also launched an operational guidelines for increasing this number in the Ayush institutions. So, and we also have our NCD, the non-communicable disease counselors in the NCD clinics, giving the lifestyle disease counseling, who would also be able to counsel for tobacco cessation. Then every dentist in this country, we are in a process to train them, to build the capacity building exercises are being carried out presently also to train them to provide tobacco cessation. So if your wish is strong, you can call the quit line. If you want to go to a physical person who can provide the counseling, you can go to any of these tobacco cessation centers. So we want you to quit if you are a tobacco user.
The focus of the government is on a healthy youth, and it is in line with the Nasha Mukt Bharat campaign. So what comprehensive approach has the government taken to make India Nasha Mukt and healthy? If you could just explain this to us.
As I said in the beginning, the fight against tobacco is the pillar of the larger Nasha Mukt Bharat movement under the leadership of the Honorable Prime Minister and the Ministry of Social Justice and Empowerment. The Nasha Mukt Abhiyan is mobilizing youth clubs, the NSS volunteers, panchayats across India, spreading awareness, providing counseling and helping those struggling with substance use. And tobacco, nobody starts with a hard drug. Tobacco is often the gateway addiction. That they start with tobacco, after that they might pick up alcohol and drugs and the synthetic drugs, etc. That's why our tobacco control efforts are deeply linked with the Nasha Mukt Bharat Abhiyan. If you can stop people from the use of tobacco and delay or even at least delay initiation of the tobacco, many of our youths will go a healthy addiction-free life, which is going to be the strongest foundation for success of not just the individual but the entire country. So together, these initiatives, of not initiating, or if you have initiated, there is a way of quitting it, is the framework for which the vision is very clear for an India where young minds are not clouded by addiction but powered by purpose in their life. And when our youth choose health, our nation is also going to choose progress towards Viksit Bharat.
Thank you so much, Dr. Swasticharan, for sparing your valuable time and telling all our listeners the benefits of not initiating tobacco at the very first stage. And if even they have initiated, there are multiple health benefits if they quit tobacco. So thank you so much for sparing your valuable time and joining us for Insights tonight.
Thank you very much.
You were listening to a discussion on Tobacco Free Youth Campaign 3.0. The participants were Dr. L. Swasticharan, DDG and Director, Emergency Medical Relief, Ministry of Health and Family Welfare, and Deeksha Saksena, Akashvani Correspondent.
Insights.